any processes or not, first have to define what processes we want to assess, and if we have any, obviously we're gonna have to have some, so we can improve them. I should theoretically have all the same ones that we improve, since we're gonna be all
So
together
how are we gonna determine that?
through the self-assessment tool. And you can't see it because it's so small. But I was gonna look at it real quickly.
So each health department's gonna do one of those, or each person?
Yes, you have to do your self-assessment tool.
Each person. Like working together.
Okay, so the self-assessment tool tells you how well your public health organization manages performance within its jurisdiction. You take a test to find out if you have the necessary systems in place to have continual improvement. And our performance is how well we do things. So how well do we vaccinate every child in our jurisdiction? How well do we do food inspections and find issues at the restaurants and other places? How well do we inspect septic systems and then relate that to failures or problems later on in the county? And I'm trying to find the cursor, and that is gone.
It's flying around your,
Is it?
yeah.
It's not on here.
Oh, it's over in that corner.
It's not on the screen over here.
Just like zero.
Oh. There, you got it up?
It went way back. Straight.
That odd.
This has never happened. I don't know if it's the new computer.
Your new used computer?
So each health department will do this self-assessment of our department,
Right.
okay? And then we will meet in January to pull this together.
Right. I mean, all of us should have the same things because we're not really any different than each other as far as our programs. I mean, I know Whitley County does have WIC involved in our programs that nobody else does, but as far as septics, foods, tattoos, pools, immunizations, you all have those same things. So, as we said before, we shouldn't try to develop everything on our own. Come together with how we do things. Let's develop a process of doing it all the same. And then we can then coordinate our efforts on making them improve.
Okay, and that's not the same as policies and procedures?
No.
No, so, okay, because to me, if you have a procedure or a policy of how you're supposed to do things.
Yes, I mean, you should, if you don't have a written policy or procedure, that will help developing some of that.
Okay,
But we want to do it in a similar manner so that we're, if somebody travels from one county to the next, and plus it helps show that we're working together to develop these things so that it's similar for each jurisdiction because we're so close together.
okay.
Okay.
Blank screen.
What? It's not blind to me? Oh, maybe number 9's not supposed to happen. I knew it was evil.
I don't think it works that way, unfortunately.
Okay, thing is, I can't show them Deschutes County Health Department example because it's,
I'm looking to see if I have a hard copy of it,
so.
because I did at one point.
We had several examples that, from different states and counties within those states that had performance management process that they had made up on one form, one page. So you didn't have, form after form to try to go through the thing. Everything was set up in a nice logical manner for us to look at. This county in Kansas was one of them that we were looking at, and we didn't know how to say it, and then she Googled it and it told us how to say it. It's Deschutes.
I don't have it.
I don't know why, I can't just bring it up on the
Yeah,
screen.
I'll have to look at it.
So I will just have to talk you through it. However, Deschutes County serves 158,000 people, so it's a little bit different than ours individually, but altogether we're the same. They developed their plan in 2002 to 2015, and they are a accredited health department. Just as an overview, their county health department performance management plan was developed to target a domain which they used as Pursue Excellence of the Deschutes County Health Department strategic plan. So this goes along with our strategic plan as well. In their management plan, we'll have performance standards, measures, reports of progress, and quality management. So as we develop the processes and implement them, we'll have to have a time of review as well, or we won't know whether they're working or not. So this is an ongoing process that won't be just something that we create and put to the side or develop a paper for that we can submit. This is a process we'll have to show improvement in. Any questions so far on what we're looking at, how we're gonna do?
So are we gonna do, like you said you were handing out questionnaires to your customer, patients, whatever you wanna, and then, so will we have to then implement this and then reevaluate with the same questionnaire at the end, is that what you're saying?
Yeah, like we ask questions that help our process. Then once we get the feedback from that, we'll analyze it and then put that into practice and then see how that works. If it improves the public health practice. And that's why it's a little bit difficult because we're not really asking questions about like wait times or do you like the color of bandages we use, things like that. We're asking public health questions, which is kind of difficult to get from the public sometimes. So that's why did you want to say anything about what we're using?
Well, I think some of the things that we were looking at was it easy for you to get an appointment? Were you able to find the time? Were our department's hours conducive to getting your children in here for the vaccination? Did you have adequate hours in the time before school started so that you could get your children's vaccines done before the school deadline?
Access to healthcare, basically.
Basically, yeah, a lot of access questions. And then, did you have any adverse effects from your vaccines? And I think that Scott said that we're not really looking at, did you like the people who took care of you or were you treated well? But those are important things too. I think that we need feedback about, are we serving the customers? Are we meeting their needs? So, did you receive your vaccine information sheets? Were your questions about your children's vaccines answered adequately? Those kinds of things.
Now, if we're doing this as a group, when we develop those kinds of questionnaires, should we all be passing that out in our health departments to?
I mean, it makes sense to me. I mean, why would you want to ask 4 different questions than what we would ask?
Well, I'm just saying, that's what I'm saying. I mean, do we need to start doing this now?
I think, forgive me if I'm wrong here, but my impression was that the performance management plan needs to be the same. The objectives that you might develop for your health department might be different than the objectives that we develop for ours because of the concerns that we have about the services we're providing. Yours may not be the same concerns. We just, in our last staff meeting, we're discussing throwing out different things to look at. And the immunization clinic and the WIC clinic were 2 things that we had some issues and concerns about and thought we could fairly quickly get some feedback from. So we decided to start with those and see how they went. But there's no reason why you couldn't do the same things, but your immunization clinic probably isn't structured the same as ours and probably is different from yours. So you may have different things that you want to actually ask people about.
But we could borrow from each other as well if we're having.
Certainly.
So the easiest way for me to kind of help frame this, just as a performance improvement person, is you're gonna have performance management here at this level, and that's what you're talking about, your collaborative document or collaborative performance management program. Under that, you're gonna have quality improvement initiatives. So right now, basically what you're looking at, or projects, however you wanna frame them, but what they're talking about is a quality improvement initiative that's going to drive your overall performance management. So what that looks like underneath there can be different depending on, you know, you may have, I don't know what you guys have locally, but like we've been working on that HIV outbreak. Okay, so for us, when we look at a performance management and we're talking about HIV STD care, for us right now, a quality improvement initiative is how do we stop it and reduce the incidence, specifically in Scott County. But anyway, so you're gonna have different initiatives under that performance management program. Does that kind of help bring the context together? No?
No, yeah,
Okay.
it does.
Just something we've really never done before at local level, or ever been asked to do that I'm aware of in the last 20 years, so.
So if you see a weakness, you might wanna grasp that and remember it for the future. I mean, no, seriously,
Oh,
just-
yeah.
like, we just had,
Right.
we had a reported foodborne, potentially a foodborne illness from a restaurant, and we had never done that before. So, where we sent samples to the state, and so, you know, is that something that we should grasp and say, okay, we can see this as a weakness and, you know, make that an area for improvement?
What I would suggest to you as you start quality improvement and performance management is look at that low-hanging fruit, which is what are the things that are gonna be able to be quick opportunities that are identified that you can quickly resolve, because you don't wanna start out with a huge project that's gonna take a lot of resources in a 6-month time frame or a 12-month time frame. But what is it you can do maybe over the course of a month? Okay, so if it's something like that you're like, okay, do a debrief, how did it go, how do we improve the process, write down the process steps you took. If we had it to do over again, this is what our process would have looked like. That becomes your new standard process of work or your new way of doing it. Then when it comes up again, that's what you bring to the forefront and that's what you use. That's kind of your analysis. Did it work, did it not work? And that's how you can then begin to, I don't know if we get this far, but you can begin to have metrics regarding, you know, what was your time of response? How quickly was it resolved? You know, what was your exposure to illness? How many people? You know, did you get it reduced by X number of people because you were able to address it much quicker? So you can look at it that way, but grab those easy, I would say easy because nothing's easy, but kind of what that low hanging fruit, those opportunities that you see quickly and try to identify. Yeah. And you can start that now. I mean, you don't have to wait until. Right. I mean, we didn't have, my LensNet had already, I had used it so long I couldn't get on it. We didn't have the equipment we needed. We didn't know, you know, where we were supposed to send it. It's just a whole bunch of things that happened that we're like, well, this didn't work very well. I mean, it ended up being fine, but,
Right.
you know,
Mm-hmm.
but that's
you
what
identified a
quality
process that
improvement
needs
is.
to be improved.
Okay, that's exactly what quality improvement is.
So write that down.
Sorry, Scott, I'll sit.
Oh, no, you're fine. You can talk all you want. Okay, so in your binders, if you go to page 200, 9.1, and you can see the definition there for performance management at the top. And then significance, obviously, is to continuously improve public health practice. And so for number 1, the health department must document the health department's leadership engagement in setting a policy for and/or establishing a performance management system. So documentation could be strategic and operational plans, training agendas, training programs. We didn't have any of this. I don't know that any of you do. Dr. Hatcher came up with a document that we have that we can send out. Documentation can include team meetings of that, our monthly council meetings, final reports showing results that we've had. Does anybody even have any of that at all? Trainings or? I didn't think we were gonna have anything. So we do have a document that we come up with, and we can send that out. I can send it to Melissa and send it to you. Dr. Hatcher came up with, but I can't show you because it won't come up on the screen.
I have hard copies.
Yeah, you can pass it.
I believe in paper. Well, I have a hard copy, I guess I should say. You looking at the performance management quality improvement process?
Yeah.
I've got, I have two of them here at least. That's one that.
It's basically spelling out what you want done in your department. And then number two, the health department must document engagement of the staff at all levels and determining the nature of performance management system and implementing it. So of course that could be meeting minutes, staff meeting minutes, board meeting minutes. That would be easy to do once you develop the system, and then introducing that to the staff. I think that would take care of document number two, and that's what we're using as meeting minutes for that.
The second document we had was we distributed to our board with the cover memo, and sent out by email. And so we have a second document that shows that we communicated it to our board
How often do you guys meet?
quarterly. The
No,
board,
your,
our staff, we
staff.
try to meet monthly.
Monthly?
Just had a Christmas party this
What do you guys do? Monthly?
Well, we've been very lax, but we were gonna try and go back to Tuesdays, every Tuesday morning, so. But just like today, we don't get one, or these
Yeah.
Tuesdays that we set up, there's not gonna be, so we might be able to knock one out a month or two. We used to do really well. Tuesday mornings was, we marked off everything, and we always coordinated calendars.
I just wondered I knew we were doing monthly, but I didn't know if anybody was doing more than that or not.
I think monthly's reasonable in my opinion.
Unless there's something coming up or something happening.
It's hard to get everybody together.
No, but that's gonna go to a weekly thing, starting next week.
This is what you developed, or?
Yeah.
Okay.
I had some samples that,
Yeah.
had been sent out. We went through them.
So this is not.
Yeah, I have them. You want
There's
them?
some there.
I like paper, you guys. Electronics fail, I'm telling you.
I'm with you.
My notebooks and my paper.
I've got binders
Yeah.
and binders at home, and I didn't transfer.
So if we do another PowerPoint presentation, we should have papers along with it.
Test it out ahead of time.
Yeah.
There we go, that's what we need for our Huber improvement plan.
Yeah.
Okay, so any questions for 9.1.1?
We have lots of questions.
Kind of see how we have to develop it and then
Yeah.
introduce it to the staff. Because kind of, straightforward what we need to do, it's just we haven't ever done that before as of yet. Do have a video here, hopefully this will work and kind of describe, hopefully. Should be able to just click on it?
I would hope. Nope.